Hello, everyone, and welcome to our summit. You are not your trauma. Break free from the past, rapidly heal negative patterns, and finally step into your calm, authentic, and lovable self. My name is Genevieve Solomon. I'm your host, and I am thrilled to introduce you today to our guest, Kurt McKinley. Kurt McKinley is a licensed professional counselor and biofeedback and neurofeedback therapist. He's worked in private practice for the past 25 years, helping patients with various mental disorders and issues, including and especially PTSD and trauma-related disorders, using counseling, biofeedback, neurofeedback, guided imagery, hypnotherapy, audio-visual entrainment, EFT, which is the emotional freedom technique, and his newly created SVT, subconscious visualization technique. Welcome, Kurt.
Thank you so much. It's wonderful to be here, Genevieve.
It is so great to talk to you. And
you as well.
I knew I needed to have you on this summit because, you know, when you're going to talk about trauma healing, you got to reach out to the best. And, you know, I've known you for a very long time, witnessed your transformation as a counselor, and have been the benefit of deep healing working with you. So thank you for your contribution to, you know, the mental health of hundreds of people.
Thank you so much.
Could you tell everybody a little bit about your transformation as a counselor? I met you 25 years ago, and your practice was very different than it is today.
It certainly was. I left graduate school in Colorado with my master's in neuropsychology, and shortly after moved to New Jersey, where I met my ex-wife in graduate school. So coming out to New Jersey was basically the first foray into counseling. I had to work in New Jersey at the time. Christy Whitman had passed the 5-year grandfathering. So you could work under the supervision of a psychologist or a neuropsychologist for 5 years to obtain your licensure without going and getting your PhD or your doctorate. So that was something that both my ex and I were interested at the time. My girlfriend at the time were interested. So I worked for Kessler Institute for Rehabilitation for 5 years to obtain my licensure. And then once I became a licensed counselor, I started practicing, and that's when we met. I was very science-based. I saw psychology more in the terms of brain behavior relationships. And I did that for a few years before starting to experiment with some mindfulness and some spirituality. And it was along the way that I met some amazing spiritual counselors and gurus that actually told me I had a different path. And then it took about 5 years, I guess, before I was fully aware of the connection with spirit. And it completely changed my practice. You know, when I started meditating, having some amazing spiritual experiences, and quickly went from the scientific, nerdy counselor to much more holistic, mindful, spiritual approach. Yeah.
Yeah, absolutely. Because when I met you, I was suffering from horrible insomnia, an eating disorder. I was a mess. And you were really helpful actually right off the bat with neurofeedback. And I thought it was kind of interesting to bring in this perspective of what I had experienced when you took pictures of my brain. And I was just, you know, in my late teens or mid-teens. And my brain was backwards. I don't know if you remember this, but you said, well, close your eyes. And then my beta waves went crazy. And then you said, open. Then my alpha waves, and you're like, You must be walking around in a daze all the
Yeah.
time. And then you can't sleep when you close your eyes. I'm like, yeah, that's true.
Yeah, your
And
brain was much more active when you would close your eyes.
and this is pretty typical of a trauma brain, right?
Yes,
Can
yes.
you explain how neurofeedback helped me as well as how it helps so many other people just sort of balance out that trauma response in the brain?
So there are two things that really have to happen with trauma work and the brain activity. Um, Shortly after a trauma is experienced, the typical awake beta, which is awake and alert when with your eyes open, kind of gets reverted to much more active when your eyes are closed. And when your eyes are open, the brain kind of goes into either an alpha or even theta dissociative state, um, which we typically see with ADD and ADHD.
Mhm.
So the initial work with neurofeedback therapy and with trauma victims, survivors, is to retrain the brain so that when the eyes are open and when you're focusing and paying attention, that the brain moves more into a awake, alert, focused state of beta, which is 13 to 18 cycles per second, especially over the frontal lobes.
Mhm.
It's just for executive functioning. And when the eyes are closed, we want that nice alpha, 8 to 12 meditative calm state, and slowing down to theta and then eventually sleep, which is delta.
Mhm.
So that's the first state for EEG normalization. And then once that's achieved, then we start to work on the specific areas of the brain that are so involved in trauma, which is the amygdala. The amygdala on the left hemisphere and the right hemisphere. And that's a whole different approach that doesn't involve neurofeedback, but does involve some of the other right brain therapies.
And so the right brain therapies are, can you explain that to me?
Sure.
Okay.
So right therapies are therapies that engage the right hemisphere and involve things like guided imagery, visualization, hypnotherapy, anything with music or art, so artistic creation. So when you kind of look at it, like there's the therapeutic approach, which engages the left hemisphere, is more talk therapy.
Right. The
Um,
traditional psychotherapy, which
Correct.
that's pretty much what you were practicing at the beginning, right?
In the beginning, I was, yes, very much so, as well as neurofeedback and biofeedback,
Right.
because that's the traditional approach that we learn in graduate school is
Right.
psychotherapy. What we know now, though, is especially for PTSD, talk therapy can actually be re-traumatizing. So now the right brain therapy is much more effective at eliciting the amygdala and bringing out whatever's in the subconscious and the amygdala, all the senses that were recorded during a trauma. We can heal those, we can release that, and we can do that by not talking about it, not engaging the left hemisphere, but using the right hemisphere. And it's quite remarkable. It's almost even magical how that happens. But when you use right brain therapy like biofeedback and guided imagery and hypnotherapy and emotional freedom technique and art and music, then you engage metaphor and symbolism and imagery. And what happens is not only does the amygdala on the right hemisphere become activated and engaged, but it lights up this beautiful bridge called the corpus callosum. And the corpus callosum connects the right hemisphere to the left hemisphere, and it goes right through the amygdala. So we can actually access the amygdala on the left hemisphere and heal the left hemisphere without engaging the left hemisphere. It's like going in the back door and healing the left hemisphere traumatized amygdala without talking about it. So it's wonderful for people who either don't want to talk about it, or when they start to, they become so emotionally overwhelmed or even dissociate. If they
Hmm.
dissociate, that's a sign that the left hemisphere and the emotional center, which is right above the amygdala, is being engaged, and you should stop talking about it. because the dissociation is there's a split between the left hemisphere and the right hemisphere. It's kind of like the left hemisphere is trying to talk to the right, and the right is saying, engaged right now. And the left hemisphere is okay, well, then we'll just split. And so the person actually doesn't even feel like they're almost in their body. They can feel dissociated. Some people have even felt out of body or disconnected. And that dissociation is a sign that, okay, whatever you're doing right now to address the therapy, or to address the trauma, stop.
How do you even discern what the trauma is that you need to heal for the person then? Like, or do you not even need to do that?
Don't even need to do.
So tell me how you do it. So is this the subconscious visualization technique that you developed? So I would love to know how this works, like logistically, like or technically. Yeah.
So I didn't develop the subconscious visualization technique. I combine 3 different techniques that are already used for different purposes and combine them into one.
Okay.
Yeah. And it was kind of like I was reading this last summer, I was reading about subconscious visualization technique and how powerful it is in accessing the subconscious mind and healing trauma and kind of engaging that hypnotherapy and subliminal programming to access what is normally kind of outside of our awareness. And as I was reading the book, I thought, this is great, but how many people can actually slow their brain down and access the subconscious mind on their own, right? Whereas I knew a lot about brainwave frequency. I know how to slow the brain down. I can help teach patients how to slow the brain down. And I thought, well, what about using the microcurrent therapy, alpha stim, to slow the brain down from beta to alpha, and then using audiovisual entrainment, the light goggles, to activate the retinal cells in the back of their eyelids, stimulate that, activate the pineal gland, release DMT into the system, slow their brain down to theta, and access the subconscious mind. So I started running myself as a subject last summer when I came up with this idea, and the results were so astounding on just my own self. I started approaching a few patients about it, and now I have a waiting list. So
yeah.
It's wonderful for clients who are not sure either what the trauma is, or they know there might be some trauma, but they're not sure how to address it. So it's kind of like the therapy goes into the subconscious mind and starts to address, well, what is it that the person can handle? Because trauma is stacked in layers through time. And the same thing with emotional freedom technique. When we tap, when we do the emotional freedom technique or the tapping, it will bring up whatever is kind of in that first layer, whatever we're speaking to about the problem statement. It will bring up in that layer.
Okay, can you explain to people who don't know what EFT is, like what that is?
Okay, so EFT is for emotional freedom technique, and it's a process whereby we're tapping on meridian points, and we're speaking to whatever problem that we're addressing. So if we're experiencing anxiety or depression, or we're having some kind of fear or phobia, or if we're just like stuck, then we just need to kind of get through that. You tap your way through the problem or the anxiety or the depression. By tapping, it's very scientific. By tapping, you're actually sending messages to the brain, and especially even the amygdala, to open up and basically release whatever kind of trapped energy you're holding on to that's causing the anxiety or the fear or the phobia. So tapping is a very hands-on, very quick, efficient, effective technique that clients can use to kind of address their, whatever's going on with them personally, internally with their psyche. And there's a wonderful, wonderful app called the Tapping Solution that I've told all my patients about, that they're now using, that I highly recommend, if someone's interested, and they could take a look at that.
Great. Okay, so I interrupted you asking about EFT, and you were in the middle of explaining SVT.
Oh, yes. So So the subconscious visual. So specifically, I have the client hooked up to microcurrent therapy, alpha stim, and alpha stim is a very gentle, safe, effective way of slowing the brain down to alpha and releasing endorphins into the system. And
Mhm.
once the endorphins are released, it not just feels, it feels wonderful, it feels very good, but the endorphins also melt away the stress hormones. So when we have things like adrenaline and cortisol and epinephrine, it blocks dopamine, serotonin, and GABA receptors that are so necessary for dealing with everyday stress, handling just everyday situations. So when those are blocked, then anxiety, depression, and other problems, can result. So when a patient's using alpha stim, which is probably the most requested um, therapy of anything I do, bar none. Like clients will do alpha stim in conjunction with psychotherapy. They'll do alpha stim in conjunction with biofeedback. They can't do it in conjunction with neurofeedback, but they'll do it in conjunction with biofeedback. And of course, SVT, subconscious visualization technique. Um, so the alpha stim has tremendous benefit for not just the endorphin release, but also melting away those stress hormones that wreak havoc, on those our neurotransmitters that we need. See, there you can hear the scientists kick in with me sometimes. I still have
And
that.
that's great. I love alpha stim. It feels very immediately calming, and it works at whatever level you're comfortable with. And I like that. Like, it doesn't make you feel out of control or anything like that.
Yeah, it's actually wonderful, wonderful. And if I see 11 people a day, which is what I'm seeing now, about 10 will say, "Can we do the alpha stem?" Yeah.
Hmm. And you then, when you have addressed the trauma going through the right hemisphere, so you
Mm-hmm.
said that it will create the bridge through
We'll
the
open.
amygdala. Oh, it'll open a bridge through the amygdala. And then at what point do you see that there's a shift and people can start talking about what happened?
And that's something that's different for everybody, but the common themes and the common symptoms are that the client is able to talk about it without becoming emotional, over emotional.
Mm-hmm.
um, they're not as bothered by it. They can
Mm-hmm.
feel the difference. A lot of times they'll say it's almost like something's been lifted, or it's like something left, or I see it differently, or um, it just doesn't have the same hold on me, that it did. Um, or they're almost excited to talk about it because they really feel the difference. Um,
Mm-hmm.
so it's just really a symptom reduction, Um, once that happens, then it's kind of up to the client. They can talk about it, we can process it if they want, or sometimes they don't even need to. But what happens is they start to notice things in their life change. Maybe they're a friend or a spouse or a family member might point out to them, like, you're not doing this anymore like you used to, or wow, you're since when did you do that? And they kind of will be like, oh yeah. It's kind of like almost like happens in the background. They just notice
Uh,
change in their behavior. Yep.
mm-hmm. So, PTSD, could you?
Mhm.
I think that that is one of the traumas that I don't necessarily feel like I understand. Could you give us a little bit of an idea of like what's happening within the body when somebody is suffering from PTSD, or what's
So
happening in the brain?
yeah, so post-traumatic stress disorder is, you could kind of think of the 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 mind and body has gone through a trauma, and it's so severe and impactful that the brain kind of goes through a series of recording the event. It records all five, if not six, some people say six senses, while it's going on. And then it doesn't shut off that recording until there is a perceived or actual elimination of the threat.
Mm.
So once the perceived or actual threat comes on, the brain starts to record all the senses, and then it doesn't shut off until it's over. And then what happens is it's kept in the brain, in the amygdala, like a database. And then unfortunately, even after the trauma, it could be days, weeks, months, or years later, if two or more of those senses become exposed, activated in your environment, the brain thinks it's happening again. And the only way it knows to protect you is to signal the amygdala and play the event again.
I
So
see.
a person can just be, at ShopRite, and suddenly, they might see, smell, taste, touch, feel something that was similar, and all of a sudden they're feeling anxious, or they're having a panic attack, or they're all feeling overwhelmed. Meanwhile, there's nothing in their environment that's an actual threat, but the brain is perceiving there's a threat, and that's the only way it knows how to protect the individual. So the syndrome can develop where the person can become so overwhelmed, and they can have various symptoms associated with the trauma, hypervigilance, startle reflex, um, of course, anxiety, sleeplessness, nightmares, night terrors, where the brain, trying to continually process the trauma, but unable to, on its own. Yep.
So, so when people are in a PTS response, then they are just hijacked, like they're completely hijacked. And then, like, what happens within them, like, naturally to help them calm down? Like, how can people, or is it not possible for people to sort of harness like their natural healing abilities to bring themselves back into balance, to cope? Of course, get treatment, but like if you're in a triggered state, what do people do to calm themselves, or what can people do to calm themselves?
So often with PTSD, there is a inability to self-regulate. The autonomic nervous system, which has the branches of the sympathetic and the parasympathetic, becomes so stimulated, and the person's in a constant state of fight flight, of sympathetic arousal. And that causes so much of the physiological symptoms that they experience. And of course, to move over into parasympathetic, it requires, the activation of the vagus nerve. Belly breathing, diaphragmatic breathing can be very helpful for that. Biofeedback, of course, but now we're starting to talk about the invasive
again. Yeah.
So, I mean, of course, there's healthy coping mechanisms, and then there's unhealthy coping mechanisms, and clients kind of go through a trial and error of trying different, therapies and techniques, some natural and some, very toxic and, dangerous. Drugs and alcohol abuse, is very, very common for people coping with PTSD. So natural remedies, are used a lot, but I don't know how effective they are. It's certainly in my practice, in my patients, we haven't had a whole lot of success with natural remedies, and that's not my field. I'm sure you're going to a lot of experts, in the course of, this seminar, will probably have some really great ideas about natural remedies.
Perhaps. I feel like a lot of the things that we've been talking about so far on this summit is more of the non-shock trauma type of trauma, like the trauma that we go through in developmental stages, or, just perhaps not getting what we need, or, being sensitive in a world where that's not, valued. But I am so grateful to, people like you with this amazing body of knowledge that can help people that are in shock trauma, because that is a horrible feeling, to be hijacked into complete panic. Like, I know, and it's horrible. So thank you. So I'm so glad that we've been able to tell people about biofeedback, neurofeedback, SVT, EFT. How does hypnotherapy work?
So hypnotherapy is an option, and some clients respond to it very well. Not for everybody, but some clients respond very well to being able to slow, relax, and access the subconscious mind through hypnotherapy. So clinical hypnosis is very good for accessing the trauma when the patient, is either completely unaware of what the triggers were, or what the, kind of like, you could think of it as um, what really happened, you
Mm.
know, not just the perception, not just the frightened perception and, scared perception of what happened, but what really happened, and having the person go back to that situation and view it without any emotional attachment, any emotional connection whatsoever, where they feel very safe, very protected, very in control. They
Mhm.
can experience that from a distance. A lot of times I'll put patients in a movie theater and have them watch it on a movie screen and they can describe it. Other times I'll have them rise above the event so they can tell me about it from even a distance, and they're very comfortable and very safe and very protected. And a lot of times that can open up a different conscious awareness of the event, so they can start to process it in a different way. Yeah.
Mhm.
Yeah.
That's really important. I think what you just said there is that that people are very in control in hypnotherapy. I think it's such a misconception that you're going to go into some sort of trance and not be able
Oh,
to get out, or be, so, you know, open to suggestion that you will not
yeah.
be
No,
able
that's
to.
that's
Yeah.
age.
I think I had that fear before I experienced hypnotherapy too. And for a long time, I blocked being able to be hypnotized. But I did have an experience in the last year where I had a tremendous healing with hypnotherapy. So now I see, oh, okay, I really was in control and am in control the whole time. And I think that's so important for people to know.
And the hypnotherapy is so really good for accessing the subconscious mind and programming healthy habits, or helping a client eliminate unhealthy habits. Um, and when you program that in the subconscious mind, which is the majority of the mind is subconscious, very similar to the iceberg on the ocean, about 20-25% is conscious, and the other 75% is subconscious, unconscious. So when you can access that and heal that, and then reprogram the subconscious mind, then you have the conscious intentions and desires and goals in alignment with the subconscious. That's really, that creates homeostasis and successful, approximations in, growth and development.
Yeah, and talk about, like, I mean, part of this summit is, we're talking about going from trauma recognition to creator of your reality. And really, that's right there. That's where it is. Like, if
Absolutely.
you want to create something, get it into your subconscious mind and have the power and the momentum coming from that vastness of what your mind is, and you being
Right.
in control with the intention, okay, actually, I don't want to be living my life in a subconscious triggered state all the time.
Right. Exactly. And, and
That's
that's what's so
it's
exciting
unhelpful.
about bridging the trauma healing therapy with helping clients not just heal that trauma, but then master, that trauma, so that they become, creative. Um, um, they become. I just drew a blank there. Um, they're able to create and manifest, with positive intention,
Mhm.
desire, and holding in mind a clear intention and feeling, a positive emotion like gratitude, creates it. So
Mhm.
they can't do that if when they start to do that, they suddenly feel afraid, or paralyzed with fear. So when you help clear that, then we can start to move to a whole different, arena
Yeah.
of conscious creation is what I was trying to think of. Yeah.
Yeah, and I really feel like meeting you in my teenage years was the first time I had a real, like, understanding of, like, oh wow, like, science and spirituality together is what is so powerful, because I was such a mess. I think with an eating disorder, basically, I think that the protocol was send people to behavioral therapists, and
Mm.
it was not doing nothing for me. And then I met you, and neurofeedback really helped calm me down. And then when you had your spiritual awakening, I could really heal by finding the spiritual, like I needed a spiritual solution to my problem,
Right.
and bridging the science and the spirit through you. And then now, I mean, right now is the most exciting time. There's just, with quantum physics and all of these scientists like really bridging these two, there's so much power in healing coming now.
There really is. There really is. And some of my favorite spiritual teachers, authors, lecturers like Joe Dispenza, are on the cutting edge of that right
Yes.
now. So it's a really exciting time.
It
Exciting time
is
to
really.
be alive.
um Thank you so much, Kurt. This was such a great conversation. It's always great to catch up with you, and I am so appreciative of you joining us and participating.
Well, thank you so much, Genevieve, and thank you for what you're doing. Spreading the word and raising awareness and educating. So many. It's wonderful.
Oh, you're welcome. So if anybody wants to try to work with Kurt, he does have a waiting list, but you can click below and you can get in touch with him there. And thank you all so much for joining us at our summit, You Are Not Your Trauma, where we're discussing the healing journey and the many ways that we can go from trauma recognition to creator of your reality. And I'll see you tomorrow. And thank you again, Kurt.
Thank you. Bye-bye.
Bye.